Hi, I'm Dylan. I'm the clinic coordinator at the RSPCA Domestic Vet Hospital. Today we're just going to have a chat about our orthopaedic cases that we get through here on a regular basis. Hey Boomy. Roughly we're looking at about maybe 1 to 2 a fortnight either surrendered by their owners who can't afford vet fees or coming in by the ambulance and not getting reclaimed. The first stage of their journey is figuring out what's wrong with them and how do we fix them. So the surgeons have to find the best way to repair the leg. Generally it's an orthopaedic implant. Then they spend up to 6 weeks going through post-op physio care. Hey sweet girl. Hi, you get your toy honey. Hello. This is Jessie. Jessie's been with us for 8 weeks or 2 months now. She initially came in with a fractured cruciate ligament on the back leg, so that needed to be repaired. We don't know any history with Jessie, so we're not sure how she caused that injury, which is the case for most animals that come in, unfortunately. So she's had a long journey. She's had her 6 weeks post-op recovery. She unfortunately had to go back into surgery because the site became infected. So she's had another course of antibiotics, and now she's just waiting to go to her forever home. After surgery, the animals generally have to stay with us for about 6 weeks while we're looking for a foster home. During this time, we're giving them massage, making sure the limb's healing well, and giving them lots of physiotherapy and passive range of motion, make sure they get full use of the leg back and that it heals up very well. This is Arthur. He came in with a broken left hind leg, broken femur, so the vets have had to go in and place a pin in there to stabilise it. And now he's just waiting for a foster home for that leg to heal up and for him to recover. Well, it's all case by case. I guess the difference with cats is they're not as tolerable to the post-op care and physiotherapy as dogs are. So it's mainly just a case of keeping them confined, making sure they're not jumping or doing anything stupid, and just giving them time for that surgery to heal. We just try and encourage them to use the muscle and use the leg, and just give them a lot of nice massage just to make it a nice experience. And then we still try and do the physio and passive range of motion as much as they'll tolerate. So the basic physiotherapy we're doing these guys is called PROMS. You might have heard it. It's passive range of motion. It's just moving the leg in its normal main range of motion, how it would normally move, and getting the muscle to return to its normal state, as well as massaging and getting them to weight bear on it as well. So when they're nice and relaxed, we can give them nice massage on their healing leg. That just helps the muscle heal and recover, and it helps with all the circulation. Passive range of motion is just moving the leg in a normal range of motion that it would be. So stretching it inwards as far as it'll go and as much as they'll let you, and then stretching it outwards as far as it'll go as much as they'll let you. And then just the normal in and out as far as it would normally move. So we do that a few times. It just it keeps the muscle in use, I guess. It helps heal it, and then afterwards we just give it a massage to help with the circulation. You're a good girl, Jessie. So the nurses will look after all their care and shelter while they're waiting to go out into a foster home, and the foster carers will then take over all their care up until they're ready for adoption. The foster carers are incredibly valuable to these patients. It takes away a huge strain from the hospital, especially when we're full of orthopaedics. Just the amount of individualised care that these animals require, it's so much easier to go out into a home where there's one person focusing on them. We're always needing foster carers to look after our ortho patients. We are looking at starting the Adopt an In-Care Patient program again, where staff and volunteers around the shelter can come down to the hospital and spend their lunch breaks with our patients, just helping them with their physiotherapy and massage and spending some time with them.